Good day, class, and thank you for attending our lecture for today. So, for this meeting, I'm going to tackle the second lesson of your AUBF, and this time we will be having the introduction to urinalysis. Since we only meet once a week, I believe that you've already performed urinalysis in your laboratory. But nonetheless, do allow me to have the lecture about it. Now, urinalysis class and body fluid analysis are performed in the clinical laboratory as part of the healthcare organization. It generally employs three basic procedures. Now, as medical technologists class, since we are medtechs, we are the ones responsible for processing bodily fluids, secretions, and excretions. And one of those that we would process is urine. Now, for us to analyze urine, there are three basic procedures that would be done. The first one would be physical examination. In physical examination class, this involves analysis of the visual characteristics of urine. So when you say visual characteristics, this refers to two: the color and the clarity of your urine. Now, question class. Here's a question. What is the normal color and what is the normal clarity of your urine? So the normal color of your urine class would be yellow, or it could also be pale yellow, and in some cases, even straw colored urine class could be considered normal. But most of the time, ang normal color ng urine nyo talaga is yellow. And for the clarity class, the urine needs to be clear. Then, another procedure that you need to employ in analysis of urine class is chemical examination. So, for the examination, this is the detection of chemical analytes found in your urine. Now, when we talk about chemical analytes or chemical examination class, you're going to test for the following: the pH, the protein, the presence of glucose, the specific gravity, then there's even blood, the presence of leukocytes, and the enzyme leukocyte esterase, bilirubin, sorry, bilirubin, urobilinogen, and the nitrite. So these are some of the analytes that you're going to test in a chemical examination class, which we will tackle in the next lesson. And the third procedure that you would need to do is the microscopic examination. So when we say microscopic examination, you're going to identify insoluble solutes in the urine. So insoluble solutes class would include cellular components. So in abnormal cases, you can actually find cellular components in the urine such as RBCs or red blood cell, WBC. In some cases, you could even find yeast cells, yeast or your fungi. Then you could also find different, aside from that, epithelial cells pa pala was. You could also find epithelial cells shed from the lining of the urethra. Then you could also find CAS. So yung mga CAS, I will discuss that also in this lecture. Now, you may be wondering, class, why is urine considered a valuable and popular specimen. So urine class is considered valuable and popular because in the first place it is readily available and easily collected. Remember, we urinate every couple of hours, so it's readily available and easily collected. Then it contains information which is important in screening discrepancies in the body's major metabolic function, and you can perform it using inexpensive laboratory tests. Now let's take a look at the history of urinalysis. So the history of urinalysis class goes back as early as in the Egyptian period. Now, uh, there was a hieroglyphic class. When you say hieroglyphics, these are parang mga wall murals. Ang ginagawa ng Egyptians noon, they would draw events on walls, and it somehow served as a way of them preserving or parang history books nila yun. Now, one Egyptian hieroglyph, the Edwin Smith surgical papyrus. Now, this is a person, ang nakita dito, there was a person referred to as an early scientist examining a bladder-shaped flask of urine. So, this Edwin Smith surgical papyrus contained a picture of a person, which they believe to be an early scientist examining a bladder-shaped flask of urine. So this would obtain diagnostic information through basic observation. Kaya nga class, if you're very knowledgeable about your urine, just by identifying the color, the clarity, and even the odor, you could already identify if a person is sick. To give you an example, class, color, let's say dark yellow, clarity, it's turbid. Then the foul, a very foul smell. In this case, class, you could consider that the patient is suffering from urinary tract infection. So when you perform urinalysis class on your classmates and you find that there is a foul smell, it's turbid, possibly yellow or dark yellow, your classmate would have urinary tract infection. So by identifying even the basic physical appearances of the urine, you get to have a diagnosis. Now, another important aspect in the history of urinalysis is Hippocrates. So you're familiar with Hippocrates class device related with the Hippocratic Oath. Now, Hippocrates class wrote his book on uroscopy. And in uroscopy class, this became a basis of early physicians to wherein the physicians would concentrate their efforts in uroscopy as part of their training. Then there is the scientist Frederick Deckers. He was responsible for the discovery of albuminuria in 1694 by boiling urine showing clumping of proteins due to coagulation and denaturation in high temperature. Then during that time class, ant testing and taste testing are methods in determining glucose in urine. So in 1694 class, yung mga tao dati, they would lick or they would taste the urine. If it's sweet, diabetic yung patient, or they would use an ant testing. So they would let the urine stand in one place, and if there are ants found after a couple of hours feeding on the urine, then the patient has is diabetic or has high glucose content. Now, another scientist, Thomas Bryant, wrote his book in 1627 about charlatans or fish prophets. Pag sinabi mong charlatans class, these are fake individuals, fake prophets, mga peking mga quack doctors. So these charlatans are fish prophets performing urinalysis and lab examination without scientific background. So he wrote a book on that. Now the credibility of urinalysis became compromised, and the book revealed that charlatans performed lab tests just for money. So because of the book of Thomas Bryant class, he was able to identify that the fake doctors or the fake scientists just perform laboratory tests just for money. However, it inspired the passing of the first medical licensure law class in England. And then another scientist, Thomas Addis, and his method of quantifying microscopic sediment. So he was the one who invented Addis count class. Sa Addis count, you're going to count the presence of red blood cell, white blood cell, CAS, and epithelial cell using a hemocytometer using a 12-hour specimen. So, ang hemocytometer nyo class next year, pagdating nyo ng third year, you would be using that. So, your hemocytometer would look like this. So, ang gagawin mo, you would add 1 drop of urine dito. 1 drop of urine. After adding the drop, you place a cover slip. Then, merong mga quadrants yan, class. May mga quadrants yan. When I say quadrants, yun yung may mga yun sa may mga boxes tapos may mga squares, ganyan siya. You would count from left to right and you would count the number of RBC, WBC, CAS, and epithelial cells under a microscope. So that's the Addis count. Then another scientist class, si Richard Bright, introduced the concept of urinalysis as part of a doctor's routine patient examination. Thus, because of Dr. of Richard Bright class, urinalysis has been an integral part of patient examination. So usually class kapag ang patient papasok sa isang emergency room or magpapa-consult, ang ginagawa ng doctor as part of routine examination, the doctor would include CBC and urinalysis. So if may nakitang kakaiba yung doctor sa urinalysis, sa CBC niya, he could already provide a prognosis or the diagnosis to the patient. Now take note of the urine composition class. Now, urine class is composed of 95% water and 5% solutes. Remember class, in the previous lesson, sa lesson 1, most of the substances of our body, as long as it's less than 70,000 daltons, are reabsorbed by the body. Kaya very few amounts lang ang solute sa urine class, only 5%. Now, the concentration of the solutes have considerable variations owing to the influence of dietary intake, physical activity, body metabolism, and endocrine function. Now, the following solutes are the primary components in normal urine class. So, the first one is your urea. Now, ang urea nyo class, your urea class is a metabolic waste product of protein and amino acid and is the major organic component of urine. Kaya nga class, if a person has a high protein diet, an observation that you would notice is that their urine class would have a strong ammonia or ammoniacal or ammonia na lang class, strong ammonia odor. Because if you would have an increased presence of urea in your urine due to a person having high protein diet. Then we have your creatinine. Creatinine class is a product of creatine metabolism by muscles. So you would tend to have class a high creatinine after an intensive exercise. So let's say sumali ka dun sa mga 42K na fun run or 21K na fun run. I thought fun run pa rin yan class, but you would have a high amount of creatinine if you perform a 42-kilometer run. And then we have your chloride. So this is the major inorganic component of urine. Kaya nga class, the urine would taste, sabi nila, salty daw. Then other electrolytes such as sodium, potassium, phosphate, ammonium, and calcium are also found. Other substances such as hormone, vitamins, and medication. Increased amounts of formed elements class are indicative of disease. For you to understand this, let's say nakakita ka ng abnormal amounts or increased white blood cell. So most likely ang patient mo may UTI. If you found increased red blood cell, most likely your patient is suffering from kidney damage, specifically glomerulonephritis. So do take note of that. So increased amounts of WBC, RBC would indicate a disease, a type of disease. Now, how would you collect your urine class? So for you to collect your urine, you need to take note of the following. The first thing you need to consider is the container. Now, when using or when collecting for urine, you need to make sure, class, that you would have a clean, a dry, and a leak-proof container. It has to be leak-proof container. And another thing to add, class, kindly take note of this, is that you would use a screw cap. Pag sinabi mong screw cap, yung iniikot class para mabuksan, tapos iikutin mo din para masarado. Then you would use disposable containers with properly applied screw top lids. Yan. It has to have a wide mouth container, wide flat bottom to prevent overturning, and leak-proof screw top. Then made of clear material and should be at least 50 ml in capacity. Individually packaged, sterile containers with secure closures for microbiological assay. Urine wee bags with adhesive for collection of pediatric patient. Label must contain the patient's name, the ID number, the date and time of collection, and other information such as the patient's age and location. Label must be attached to the body of container glass and not on the cap. Specimen must be accompanied with a properly completely filled requisition form. Now let's continue. Now, when would you reject class specimen? The first rule, even when you reach your internship, even when you reach your real practice as medtech class, don't forget this rule. Always reject unlabeled specimens or unlabeled containers. This is a mortal sin in our laboratory. And if there is a unlabeled specimen or unlabeled container, requests for a new collection if identification conflict arise. Or you could ask class the nurse or the patient or whoever brought the sample to write their name or the label in it. But if not, have a new collection, repeat collection. Then another cause for rejection class is non-matching labels and requisition form. Example class, ang nakalagay sa specimen nyo is Andrew Tate. Ang nakalagay sa requisition is Ethan Tate. Automatically class, this type, you need to have a repeat collection, or you need to have the nurse or you need to have the patient correct them by providing ID. So you could request for new collection and do not perform the procedure on the non-matching labeled specimen. Then another cause for rejection class is if your urine is contaminated with feces or toilet paper. So this actually happens, class. This actually happens in certain patients. May mga patients tayong pasaway, class. What they would do is that they would scoop urine from the toilet bowl. Diba? Sabi mo mag-collect ng urine. Ang ginawa, nag-scoop ng ihi sa toilet bowl. So you need to reject that. This can lead to erroneous results in the examination of urine. So mamaya, kung masyashock ka, you would find parasitic worms. Let's say positive yung patient for ascariasis. So, yung stool na halo nga sa urine, you'd find parasitic worms or ova or eggs in the urine. So, this can cause erroneous result. Then, you also have to consider contaminated exteriors of containers. So, disregard and discard urine specimen. So, there are patients kasi class, they would use unorthodox or abnormal containers. Yung mga containers na nakikita sa bahay, baka ilagay sa lagayan ng pabango, lagay sa ng ice cream, something like that. So you have to reject those. Then insufficient quantity class. So at the minimum class, the amount of urine should be collected should be 50 ml, even though only 12 ml is actually used. Always class to have extra urine so that when you do a repeat testing, it would be convenient. So that's the reason why we always have an extra amount of specimen for urine. Then if they are improperly transported class, so if they are left standing for 2 hours without preservation or refrigeration class. So let's say class a situation wherein urine is collected at the house and traveled at the lab. If travel time class would exceed 2 hours and the specimen is not refrigerated or preserved, the specimen should be rejected. So let's say class yung bahay mo is nasa Ilocos. Ang laboratory mo nandito sa Manila. Ang travel time from Ilocos to Manila would be 8 to 10 hours. So umalis ka ng 8 p.m. ng gabi, nag-collect ka ng urine. Dumating ka sa Manila ng mga bandang 6 a.m. to submit the urine. As medtech's class, pag ganyan, you have to reject the specimen. It already exceeded the 2 hours. The 2 hours without preservation. Then the laid urine sample is undesirable for urinalysis and may cause a series of reaction in the urine sample without preservative. So later class you will learn about the changes in urine if they are not preserved. Dapat please remember that urine should be processed. Please take note. Urine should always be processed within 2 hours after collection. So if you collected that at 7 a.m., it needs to be processed on or before 9 a.m. Now, what are the ways to preserve your specimen class? So in cases wherein the test cannot be done promptly and various changes would occur in a specimen that that would be unpreserved. So these are some of the commonly used preservative class. The most routinely used class is refrigeration at 2 to 8 degrees centigrade. So refrigeration would impede bacterial growth. No chemical preservatives are added. Then the second type is your formalin. So this is a good preservative for sediments. But its drawback or negative effect is that it would precipitate protein and would act as a reducing agent. So it may alter other chemical analytes in urine, like the amount of glucose and protein. Then we have your toluene, which would preserve ketones, proteins, and reducing substances. Thymol, which would preserve glucose and sediments well, interferes with acid precipitation of protein. Then we have your chloroform, used for inhibiting bacterial growth. Boric acid, which would preserve sediments but interferes with pH reading. Ang boric acid nyo class would make the urine too acidic. Masyadong acidic yung pH. Then we have your chlorhexidine. This is used in preserving glucose and prevents bacterial growth. Then you could also use commercially prepared preservative tablets. Then sodium chloride class is the preservative used for drug analysis. So do memorize the different ways class on or the different ways and the different chemicals used in specimen urine preservation. Now, what are the effects of unpreserved urine in room temperature class? So let's say you weren't able to process the urine within 2 hours. So this is what's going to happen. There would be decrease and increase class. So let's start with the decrease effect. There would be decreased clarity. When you say decrease clarity class, the specimen would become turbid. So it would become slightly hazy, slightly turbid, and turbid. So these are the ways on how you report clarity. But take note, class, that if there's decreased clarity, your urine becomes turbid. Then there would be decreased bilirubin. The reason because the bilirubin is going to be oxidized, and also decreased urobilinogen due to exposure to sunlight. Urobilinogen class is oxidized to biliverdin and urobilin, leading to decreased bilirubin levels. Sorry, take note pala. Bilirubin class is oxidized into biliverdin and urobilin, leading to decreased bilirubin level. Si urobilinogen nyo class nadi-decrease siya once exposed to sunlight. So let me repeat. Bilirubin is oxidized into biliverdin and urobilin, causing its levels to decrease. Then glucose class, it decreases because of bacteria, which will metabolize glucose for glycolysis. So, di-decrease yung glucose nyo class because bacteria will metabolize glucose for glycolysis. Then ketones, they are known to be volatile, easy to evaporate. Prolonged standing causes evaporation. Then yung mga formed elements, yung mga Cas would disintegrate in prolonged standing. Increase naman class, there would be an increase in bacterial count because again, they would thrive and multiply. They would also reduce urea to ammonia, and ammonia causes ammoniacal urine odor. In addition, ammonia is the reason for increased urine pH. So yung pH class, if you stand urine, the pH increases. So if you have a two alkaline urine, pakitandaan to. If you have a 2 alkaline urine, most likely that the sample is old na, more than 2 hours. The nitrite amount increases because of the conversion of nitrates due to the presence of bacteria. The urine color would also be modified or it would become darkened. So paki-memorize na lang to class para maalala nyo siya. Decreased clarity, glucose, ketones, bilirubin, urobilinogen, and formed elements. Increased bacterial count, increased ammoniacal odor, pH, nitrite, and darkening of the color of the urine. Now let's talk about the types of urine specimens. So the most common and the most routinely used class is the so-called midstream clean catch. So this is the method of choice for non-contaminated specimen. So let's discuss the procedure on how to perform midstream clean catch for females first. So for females, kindly wash your hands, spread or separate the skin folds of the labia. So you could refer to the picture class on how the labia is separated using two or three fingers. Then get an antiseptic towelette or hypoallergenic soap. So yung iba class, they would just wash it with running water. They would use running water with soap to clean the urinary opening. But you could also use antiseptic towelette just like in the picture. So you would clean the opening of the external genitalia. Cleans from the front to the back of both sides of the labia. So pakitandaan na cleans front to the back of both sides of the labia. Open your urine container, remove the cover without touching the inside of the container or the lid. Urinate class. So here's the important part. When doing midstream clean catch, the first part of the urine class must be voided into the towel, into the toilet bowl class. So pag nag-ihi ka, yung first part na lumabas should be directed into the toilet bowl. After several seconds, bring the urine container into the stream. So sa kalagitnaan or in the middle part class, you now collect the sample of at least 50 ml. Kaya siya tinawag na midstream because you're collecting the middle part of your urine. The first part and the last part are voided into the toilet bowl. Cover the specimen with the lid and label the container at the side and not on the lid. Now, for females class, wash hands. Then, if you're uncircumcised, retract the foreskin. So, if most Filipinos naman class are circumcised, so it won't be a problem. Then again, wash it with soap or a antiseptic towel. Clean the tip of the penis if uncircumcised. Retract the foreskin. Again, follow the procedure. Open the container, urinate, have the first part voided into the toilet bowl. Then, after several seconds, bring the urine container into the stream and collect 50 ml. Void the last part in the toilet bowl. Cover the specimen with the lid. Then, label the container at the side and not on the lid. Place at a specified area or follow institutional policy. So that's how you would collect midstream clean catch class. Very important na you would wash your genitalia first before collecting. Now, there are considerations, class. Take note of this. Considerations when doing midstream clean catch. So again, wash the external genitalia with mild antiseptic. Initial portion of urine is allowed to escape while the midstream portion is collected. First part class is not included in the sample because of the probable presence of bacteria that can contaminate the urine sample. So the reason why they don't include the first part class is because it could get contaminated by bacteria. While collecting the middle part, after several seconds, do not touch the inside of the container or allow the container to touch any part of your genitalia. Final portion of urine is also discarded. This is because of possible contamination if the patient ever touched the genitalia with their hands. Bacteria may be present and it would cause a false positive result. So yun din yung reason class for the why the last part is voided into the toilet bowl. There's a possibility that you could contaminate the sample. This is routinely used for urinalysis class and bacterial culture. Most routinely type perform or most routine perform type of urine collection. Then we also have your catheterized specimen. So when it comes to catheterized class, you would use a catheter. So ang catheter nyo class, ipapasok nyo yan sa urethra ng patient. So kung ang lalaki, yung penis ng lalaki, 'di ba, yung we have yung urethra ng lalaki is longer. So from the head of the penis, ipapasok dyan, class. Ipapasok dyan yung catheter. So what a very painful experience. Sabi nila masakit daw yan. I've never tried it. But you would insert it into the penis, into the urethra, class. So you would insert a hollow tube through the urethra into the bladder. So this is usually done for bacterial culture. Sa females class, it is less traumatic or less painful. Then we have your suprapubic aspiration. So when you say suprapubic aspiration class, you're going to use a sterile syringe and needle. Then you're going to collect directly sa bladder ng patient. So ang gagawin mo, you would introduce the needle through the abdomen. From the abdomen class, it would pass through to the bladder. And from the bladder, you would collect the urine sample. Now, this is the most sterile because it is directly collected from the bladder, completely free of extraneous contamination. This is best used for bacterial culture and cytologic studies. So that's your suprapubic aspiration class. Then we have your three glass collection. Now, three glass collection class, please take note, is used to determine prostatic infection. Ang three glass collection class, this is used, take note, this is used to differentiate, differentiate uh, urinary tract infection from prostatitis. Gusto mo kasing malaman kung yung cause ng bacteria or cause ng is UTI or prostatitis. So all portions of the urine are collected in three separate containers. So you're going to use three separate containers class. They are labeled beginning, middle, and final. So the prostate gland is massaged prior to collection in the third container. So ipapasok ng doctor yung kamay niya class dun sa rectal area mo, pipisil-pisilin niya or imamassage niya yung prostate gland niya. So higher WBC and bacterial count in the third container compared to the first container indicates prostatic infection. Second container serves as a control, but if both the second container and the third container tested positive for bacteria, the result would be invalid. It only indicates that the patient is suffering from UTI, thus contaminating the third container. So ganito lang yan, class, for you to understand. If it is UTI or urinary tract infection, the first uh, the first and second container, yung beginning and middle, would become positive for bacteria and WBC. But if it is prostatitis, the first and the second would be negative. But the third, after i-massage yung prostate, would become positive for bacteria and WBC. So, pakitandaan yan ha. Yung beginning and yung middle, if it's UTI, would become positive for bacteria and WBC. Pero kapag prostatitis, only the third, yung final container, would be positive for bacteria and WBC. Now, first part of the urine is labeled as beginning, middle part is labeled as middle. Now, before collecting the last portion, the doctor or urologist will massage the prostate gland located at the back of the rectum. This is to make sure that the prostatic juice would join the urine in the final container. Then the last portion is labeled as final. So beginning, middle, and final. So take note of that. Then another specimen, yung pediatric specimen. They would clean plastic bags with hypoallergenic adhesive. So dito class gagamit kayo ng mga skin adhesives na may plastic bag. So this is usually done class for pediatric patient kasi 'di ba mga pediatric patient hindi sila makakollect ng urine. So they would what they would do is that they would attach this near the genitalia. So specimen can be collected in two ways. So rub a piece of cotton on the external genitalia of the baby to stimulate urination and catch the urine with a container. Or you could use pediatric bags class. So ito yung mga pediatric bags. So adhesive tape is stick to the navel of the baby and the bag opens directly to the genitalia. Wait for the pediatric patient to urinate. So that's the pediatric bags used for pediatric specimen. Then we have your drug specimen collection class. So all personnel handling this specimen is documented. So when you say documented, the name and the position are known kung sino yung nag-handle ng specimen. A form called the chain of custody class is duly accomplished to document every step. Yung chain of custody na yan, class, maririnig mo yan sa mga police, especially pag magta-transfer sila ng evidence. So they need to provide a chain of custody. Kanino napunta yung sample? What was the name of the person who took the sample? Something like that. So the urine collection can either be witnessed or unwitnessed. And urine temperature must be taken 4 minutes after voiding and must fall between 32.5 to 37.7 degrees centigrade. Now let's continue class with the another type of specimen. This time we will deal with the timing of urine specimen. So when you say timing of the urine specimen class, this is related to a certain amount of time needed to be followed in collecting urine sample. So there is a time needed to be followed or a protocol regarding time collection of urine. So the most common one is the random urine sample. This is the most convenient class, but the problem with random urine sample, it is prone to erroneous results, usually collected class within any time of the day. Then we have the first morning. So the first morning is the ideal and preferred type for routine urinalysis because it is more acidic and concentrated. There's a high chance class that you can see many sediments collected the moment the patient wakes up in the morning. So considering all of the types of urine specimen class, the best type of urine specimen that you could use for analysis is the first morning midstream clean catch urine. So that's considered as the best specimen used for analysis. And then there's an important type of sample or urine class is the 24-hour or the time specimen. So this is used in measuring exact amount of urine chemical. When you say urine chemical class, we're talking here about the urine protein and urine glucose as well as other chemicals or constituents that can be found in the urine such as your sodium. Now, the instruction in a 24-hour urine specimen class is that you're going to collect sample for 24 hours. Example here is that the doctor would instruct the patient to collect the specimen at 7 a.m. Saturday. So, ang starting niya class would be, the start would be 7 a.m. Saturday. And after 24 hours, it would be the end. So, the end of collection would be 7 a.m. Sunday. So take note, class, that before 7 a.m. on Saturday, the patient must make sure that he or she had already peed before the specified time. So meaning, class, when you start your 24-hour, kindly write this down. When you start your 24-hour urine collection, you must make sure, class, teka, burahin ko ah. Let me just erase this. So again, when you start your 24-hour urine collection, you need to make sure that the bladder or your bladder is empty. Take note of that. Ha? So before starting your 24-hour collection, you need to make sure that you have an empty bladder. Okay, if you read the statement, before 7 a.m., the patient must make sure that he has already peed before the start. So dapat empty. Now, by 7 a.m. Saturday, patients must collect all of their urine all throughout the day in a large water container. So, usually, class, ang ginagamit na container dito yung mga 5 gallons na Wilkins. So, they would use that. After 24 hours, the last urine of 7 a.m. Sunday must be included and collected as a sample. So, after 24 hours, class, once you wake up the next day, you need to also collect the sample. Do not discard. Then bring it into the laboratory class, and the urine must be mixed thoroughly, and only an aliquot is utilized for chemical testing. So let's say, class, the patient was able to collect 3 liters of urine in 24 hours. Kukuha ka lang, you will just get a portion. Let's say, siguro mga 5 ml out of 3 liters. So this is very useful in calculating hormones and electrolytes such as catecholamines, 17-hydroxysteroids, in which their concentration is greater in late afternoon and low in early morning. So catecholamines and 17-hydroxysteroid have a great concentration in late afternoon and very low in early morning. Then another type of urine sample class, the glucose tolerance sample. So this is used class for testing glucose levels in blood sample. So this is rarely done in the laboratory. They are usually done in conjunction with blood glucose. So urine and blood is taken at several intervals, usually every 30 minutes. Then you're going to correlate the amount of sugar both in the blood and the urine. So fasting 30 minutes after ingestion of glucose load, 1 hour after ingestion of glucose load, 2 hours after ingestion of glucose load, and 3 hours after ingestion of glucose load. Okay, for you to understand this class, this is in your chemistry, this is known as the OGTT or the oral glucose tolerance test. So what the medtech would do is that he will instruct the patient to ingest or to drink a glucose load. Para siyang ano class, sweet, matamis na drink yan. It's a sweet drink. So the patient would perform fasting. And then once nag-fasting siya, he will be ingesting this sweet drink or this glucose load. And then 30 minutes after ingestion, you would collect urine and you would collect blood. So that's the first collection. Now, 1 hour after ingestion, so 30 minutes na yung nakalipas class. After an hour, you would do your second collection of urine and blood. Then 2 hours would be the third collection of urine and blood. And the fourth one, collection of urine and blood. So class, ang mangyayari dyan, if the glucose in the blood is high, if the blood glucose is high, expected also class that the urine glucose would also be high. Because remember, there's a possibility that it would go beyond the renal threshold. So let's say ang blood glucose mo class is on the second or on the third collection, you got a 190. So, di ba 190 milligram per DL is above the renal threshold. So, there's a possibility that urine glucose would be positive or high. So, that's the glucose tolerance test. Now, let's go to the physical characteristics of urine class. So, the most common physical characteristic of urine is color class. Now, color class is the best index the to assess the concentration of urine. A noticeable change in color is often due to erroneous metabolic disorder. The most common description of colors would include pale yellow, yellow, and dark yellow. So I want you to memorize this class. There are three pigments responsible for normal color. Urochrome, this is a product of body's metabolism and is increase in dehydration, responsible for the yellow color in urine. Then we have your uroerythrin. This would attach to urates, thus giving pink color to the sediment. And then urobilin. This is a product of oxidation of urobilinogen, and would give an orange brown color to urine that is not fresh. So take a look at this urine color chart class. So as stated here, if your urine matches the colors numbers 1, 2, and 3, so ito daw, 1, 2, and 3, so from pale yellow, basically straw, I believe this is a straw colored urine, then pale yellow, you are considered hydrated, or you have enough fluids in your body. But if your urine matches the colors numbers 4 to 8, you are dehydrated and would need to drink more fluid. So, dehydrated ka. And remember class, kapag dehydrated ka, you have less fluids. And if you have lesser fluids, what happens is that your urine will become more concentrated. Mas madaming solutes na present, mas madaming sediments. That's why class, if you have a darker urine color, most likely you have more sediments in your urine due to a possible dehydration. Now, what are the different abnormal urine color? So, in some cases, class, please take note that the colorless or the pale yellow color or the pale straw color is a sign of polyuria. When you say polyuria, class, this is known as your increased urine output. So you keep on urinating, class. And polyuria could be caused by diabetes mellitus and diabetes insipidus. But in some cases, class, wherein you just recently hydrated, tapos nag-urinate ka, most likely colorless or pale yellow ang urine mo. But in a disease related context, class, colorless or pale yellow urine is related to polyuria or increased urine output seen in diabetes mellitus or diabetes insipidus. Then we have amber. This is usually caused by the presence of bilirubin. Then orange yellow class. This is caused by the drug pyridium. Pyridium is a drug for UTI. Then phenindoin can also cause it. Then an orange urine glass could be caused by vitamin C, bilirubin, carotene, carotene overdose, usually from carrots. Then yellow-green urine is caused by the presence of biliverdin. So biliverdin is caused by the oxidation of bilirubin. So pag yellow-green class presence of biliverdin. Green urine class is caused by an infection with Pseudomonas aeruginosa. So this is a bacteria class that can cause a green urine. Then blue-green urine could be caused by the ingestion of chlorets, methylene blue, phenol, indican, the presence of heart-nap disease or blue diaper syndrome, infection from Pseudomonas aeruginosa. Then cloudy, smoky red or pink urine. This is characterized by hematuria or RBC in the urine. So hematuria class is red blood cell in your urine. Then if it's clear red or pink, this is hemoglobin. Presence of hemoglobin in the urine. Red pigments from beets or strawberries could also cause a clear red or pink urine. So take note of that. So ang cause ng clear red or pink urine is the so-called hemoglobinuria. So the presence of hemoglo LO, binuria in the urine. While the non-pathological cause is the ingestion of beets or strawberry. Then if it's red brown or light brown, this is caused by the presence of myoglobin. So myoglobin class is a type of hemoglobin released from the muscle breakdown in extreme exercise. Then we have your purple urine. This is caused by infection with Klebsiella or Providencia. Then we have your burgundy red or purplish red or port wine seen in cases of porphyria and lead poisoning. Then we have your brown or black urine class. This is caused by homogenesic acid seen in alkaptonuria, originally yellow before 30 minutes of standing. To explain this class, if a patient is suffering from alkaptonuria, urine niya would usually be yellow. But if you let it stand for 30 minutes, it's going to be converted into a brown or black color. Then, other causes of brown to black urine is the presence of melanin, methyl dopa, metronidazole, argerol, and phenol derivatives. Then, ingestion of fava beans could also cause brown or black urine. Then another type of urine color is yung cola colored urine. This is caused by methyl dopa and levodopa. So this is a drug for Parkinson's disease class. Yung methyl dopa and levodopa niya produces a cola colored urine. Then we have your bright yellow urine seen in mepacrine and atabrine. So mepacrine and atabrine class is treatment for malaria and giardiasis. Ingestion also of riboflavin could also cause bright yellow. Then we also have bright orange red urine. This is caused by ingestion of the drug, the antibiotic rifampin, which is the treatment for TB. Then cloudy urine usually seen if there are white blood cells in cases of urinary tract infection. So do memorize class the different urine colors. They may come out in your quiz. Now, after color class, another physical examination to be considered is yung urine clarity. So this is usually determined by visually examining the specimen placed in a test tube while holding it in a front source. So what the medical technologies class would do is that compare they would compare it against a newspaper print, a newspaper print. Kapag visible yung newspaper print class, it's clear. If it's slightly visible, it's slightly cloudy. Then, if no longer visible, it's cloudy. Then, yeah. So, clear class refers to a transparent urine with no visible particulates. Slightly hazy or hazy, presence of few particulates floating, but newsprint is still, excuse me, visible. Then, cloudy, presence of many particulates, newsprint is blurred. Then, turbid, newsprint cannot be seen anymore. Milky class urine has clump or coagulated or precipitated appearance. So take note of the five urine clarity. Clear, slightly hazy or hazy, cloudy, turbid, and milky. Now, what are the causes of abnormal urine clarity class? So the most common cause of abnormal urine clarity is the presence of precipitates. Identification of these sediments is valuable in determining if the cause of turbidity is pathological or non-pathological. So take note, class, that there are different causes of turbidness in urine. It could be pathological or non-pathological. So if it's non-pathological, class, this is usually caused by the following: prolonged standing, refrigeration of urine, or improper preservation. So take note of this class: squamous epithelial cell, mucus, amorphous phosphate, carbonate, urates, semen, spermatozoa, fecal contam, radiographic contrast media, talcum powder, and vaginal creams. Now, all of this are non-pathological causes of urine turbidity. Now, let's talk about the pathological naman. The pathological causes class of urine turbidity would indicate the presence of infection or or metabolic disorder. Now, these are important substances that must be reported in the urinalysis result form. So these are the following pathologic causes: RBC, WBC, bacteria, yeast, non-squamous epithelial cell, abnormal crystal, lymph fluid, and the presence of lipids in the urine. So do memorize them. The non-pathologic and the pathologic causes of urine turbidity. Now let's go to the urine specific gravity class. Now when we say urine specific gravity or specific gravity, this refers to the ratio of the weight of a volume of urine to the weight of the same volume of distilled water at a constant temperature. So ulitin ko class, SG refers to the ratio ng weight ng volume ng urine to the weight of the same volume of distilled water at a constant temp, used to measure the concentrating and diluting ability of the kidney to maintain homeostasis. So the normal range of specific gravity for random urine class is 1.002 to 1.035, while the range for a 24-hour urine specimen is 1.015 to 1.025. Now, there are different terms used to describe specific gravity. The first one is your isostenuria. Isostenuria class refers to the specific gravity of urine set at 1.010. Very balanced siya class, or very normal. This is also called isostenuric urine. Indicates poor tubular reabsorption. Then we have your hypostenuria. This is a specific gravity of urine that is below 1.010, also called hypostenuric urine. Then we have your hyperstenuria. This is a specific gravity of the urine above 1.010, also called hyperstenuric urine. So those are the three terms class: isostenuria, hypostenuria, and hyperstenuria. Now, if it is consistently high, take note class, the causes of a consistently high specific gravity, usually 1.020 to 1.035. So these are the causes: dehydration, proteinuria, glycosuria like DM, eclampsia, heart failure, inappropriate secretion of ADH, and glomerulonephritis. If it's abnormally high, 1.040, this could be caused by radiographic dyes, plasma expanders like dextran. And if it's consistently low, 1.001 to 1.003, the patient could be suffering from diabetes insipidus, diuretic medication, and pyelonephritis. So take note of the types of abnormal specific gravity and their causes. Now let's talk about diabetes mellitus versus diabetes insipidus. Now, baka nagtataka kayo, class, bakit may dalawang klaseng insipidus? Class, there are a lot of variations of diabetes. Sa, you will learn that in your CC2, CC1, clinical chemistry 1. But let's discuss them, the diabetes mellitus. So, diabetes mellitus class is caused by a defect in the pancreatic production of insulin. So, may problema sa pag-produce ng insulin. While diabetes insipidus naman class is caused by the loss of function of ADH or the antidiuretic hormone. So both of this, both diabetes mellitus and insipidus would cause urine to appear diluted. Then for the specific gravity, ang tatandaan nyo lang, if it's the specific gravity of diabetes mellitus, it is increased. The reason class because there is too much glucose in the blood. And then if it's if it's diabetes insipidus, there would be decreased SG. Again, the reason for this is because of the inability of the kidneys to reabsorb water. So glycosuria is present in DM, absent in diabetes insipidus. Diabetes mellitus, the odor of the urine is fruity or sweet, while in insipidus, it tends to be aromatic. So take note of the difference between DM and DI. Now let's go to another method in measuring specific gravity of urine. So we have the reagent strip class. So the reagent strip class is based on the principle of pKa. pKa refers to changes of polyelectrolyte by ions present. So we also have urinometer, requires 10 to 15 ml of urine, composed of hydrometer that is calibrated to measure specific gravity at 20 degrees centigrade. Employs the principle of buoyancy. So the urinometer will float higher in urine than in water because urine is denser. Take note of that. Now, when using the urinometer class, there is a problem. The problem with using a urinometer is that it is only limited to function at 20 degrees centigrade. So if the sample is set at a greater temp, you need to perform a temperature correction. So please take note, for every 3 degrees above 20 degrees centigrade, add 0.1 to the urine's specific gravity. For every 3 degrees below 20 degrees centigrade, subtract 0.001 from the urine's specific gravity. You are also required class to perform protein and glucose correction. So for every gram per DL of protein in urine, subtract 0.003. For every gram of DL for glucose in urine, subtract 0.004. So example class. A laboratory report states that urinometer reading of urine specific gravity is 1.030. Correct the SG reading if the temp of the urine is 32 degrees centigrade. Okay, so you need to make a correction here, class, again, because the temperature of the sample is above 20 degrees, so 32 degrees. So if we apply the formula, for every 3 degrees above 20 degrees, you need to add 0.001. So 32 minus 20, you would get 12 degrees centigrade above. 12 degrees divided by 3 is equal to 4. So for every 30 degree above 20 degrees, add 0.001. So the original or the given specific gravity plus 0.001 times the amount that it would be multiplied or corrected, which is 4. So the corrected, based on temperature correction, is 1.034. Now another problem, this time naman class, there's the presence of protein and glucose. So you need to do correction for every gram or dl. So correct the specific gravity reading if the urine contains 3 gram per dl of glucose and 5 gram of dl of protein. So pakitandaan class, again, pag may isang gram, if there's 1 gram of protein, you need to subtract 0.003. For every gram of dl of glucose, 0.004. So dito, may 3 grams ng glucose. So 0.004 times 3, you get 0.012. While if naman protein class, 5 grams per dl. So 5 times 0.003 would get you 0.015. So you add that, 12 plus 15, 0.027. You'll subtract it now, class, to the original specific gravity, which is 1.047. You would get 1.020 as the corrected specific gravity required in protein and glucose concentration. Now, another method you would be doing, class, is the use of refractometer. It would require 1 to 2 drops of urine, employs the principle of refractive index, which is the ratio of the velocity of light in air to the velocity of light in urine. So, velocity of light in air versus, class, the velocity of light in urine. The path of light is deviated when it enters a solution, and the degree of refraction is equal to the urine's specific gravity. So, unlike urinometer, class, sa refractometer, you don't need to perform correction sa temperature, but it requires protein and glucose correction. So, no temperature correction, but it would require protein and glucose correction. So again, for every gram of protein, subtract 0.003. For every gram of glucose, 0.004. So I believe, class, ginawa niyo to sa laboratory, itong refractometer na to. Now let's talk about urine volume, class. So there are different types of urine volume, and they could be affected by the body's state of hydration. Now take note, class, that the normal urine daily output is 1200 to 1500 ml, with a range of 600 to 2000 ml considered normal. So we have variations in urine volume. The first one is oliguria, class. Oliguria refers to the decrease in urine output, usually less than 400 ml, seen in dehydration states like those suffering from diarrhea, vomiting, excessive sweating, and burns. Then we have your anuria. This is characterized by the cessation of urine flow. So as much as you want your urine to come out, walang lumalabas, class. This is anuria, seen in patients with serious damage to the kidney. And then we have your polyuria, increase in daily urine volume greater than 2500 ml in adults, seen in cases of diabetes insipidus, diabetes mellitus, and uh, intake of diuretics like coffee and alcohol. So I want you, class, to memorize this table. Baka lumabas to sa quiz. Then another factor you need to consider is urine pH, class. So when we talk about urine pH, the main organs involved in maintaining urine pH, class, are our kidneys and lungs. They monitor or regulate acid base of our body, especially the kidneys, class, which are tasked to secrete hydrogen ions and reabsorption of bicarbonates. So a healthy individual usually produces first morning urine with a slightly acidic pH of 5 to 6. While for normal random sample, class it would be 4.5 to 8. Noting the pH of urine is essential to determine acid-base disorders of metabolic or respiratory origin. Furthermore, urinary crystals can be identified by determining pH. Kasi class merong mga acidic crystals. When you say acidic crystals, they can only be found in acidic urine. Meron din namang mga alkaline crystals. They are found in an alkaline urine sample. Then you also have to consider urine odor class. So the thing you need to remember here, the normal odor of freshly voided urine is aromatic. But if it is allowed to stand prolongedly, it would produce an ammoniacal odor. So pakitandaan nila sa if it's freshly voided, aromatic. But if it's allowed to stand, it would have a ammonia smell or ammoniacal odor. This is usually caused by the breakdown of urea class to ammonia. But there are certain serious metabolic defects that could be screened if the following odors are observed. So pag fruity or sweet yung odor, most likely diabetes mellitus due to ketones. If it is rotten fish or smells like galunggong, you have a metabolic disorder, trimethylaminoria. If it smells like sweaty feet, isovaleric acidemia. If it's mousy, yung odor, PKU, PKU or phenylketonuria. Or if it smells like cabbage, there is methionine malabsorption. If it is caramelized sugar or maple syrup smell or odor, it's MSUD. MSUD stands for maple syrup urine disease. If it smells like bleach, it's contaminated. Sulfur, seen in cystine disorders. Then if it's ammoniacal, even though it's freshly voided, so hindi siya aromatic class, it's urinary tract infection. So that ends the lesson 2. Thank you.